So, Daratumumab for AL amyloidosis. For the past, several years, there's definitely been a hint that this is a very impressive drug in patients with AL. But just this year, 2020, there have been a number of publications that are really codifying the importance of this drug in patients with AL. So the first one is in pre-pub currently, and that's by Palladini and colleagues, and that's the run-in for the ANDROMEDA trial, which is a randomized trial for patients with newly diagnosed amyloid. Patients are randomized to either cyclophosphamide, bortezomib, dexamethasone, with or without daratumumab, and it's subcutaneous daratumumab. So the actual randomization information isn't available yet, but that'll be coming. But they did publish the sort of the run-in data. So just the experience with the quadruplet daratumumab, cyclophosphamide, bortezomib, index, the safety and response of just a few dozen patients there as part of the trial. And what that showed was very impressive VGPR rates in the range of 82%, so VGPR and better in these patients, which is sort of an unprecedented kind of a number. And then as far as CR, complete response, that's in more than half of patients. So it looks really promising, but obviously we'll be waiting for the randomized trial to see the comparator arm and the quadruplet, the triplet versus the quadruplet. But that's exciting that it's tolerated and effective. So that's number one. But the real interesting publications. There were 3 publications in Blood, and that included 2 relapse trials, so prospective clinical trials, one from France and one from Boston University. And then the other was a very large cohort of patients who were treated in Heidelberg or Germany with either daratumumab and dex or daratumumab and bortezomib and dex. And sort of looking at those patients in aggregate, there are a number of really interesting observations in the relapse setting. So the first is that the hematologic partial response rate is in about anywhere, depending on the series, between 2/3 and 90% of patients will get a hematologic partial response in terms of very good partial response or better, depending on the study, anywhere from 55 to almost 86% will have a very good partial response. Now, if you sort of put it in the context, each of those things in the context of multiple myeloma, the partial response rate in relapsed myeloma patients is 1/3 of what we see here. And in terms of the VGPR as well, we're looking at a quarter, less than a quarter as many patients with myeloma get a very good partial response. And if we think of progression-free survival, so in these studies, again, depending on the study, and they were different in terms of, how many prior lines or what the overall plasma cell burden was at entry, but essentially progression-free survival in these relapsed amyloid patients or relapsed refractory amyloid patients was in the order of a year to 28 months. And again, in the relapsed refractory myeloma population, you'd expect, like a 4-month progression-free survival with single agent drug. And so this is, really interesting. Now, a couple of caveats there. In relapsed myeloma trials, patients are way more heavily pretreated and so on and so forth. But still, I think this is really interesting and exciting and provides a platform to build upon.